Heiderbrink. I'm a neurologist and co-leader of the clinical core at the center, and I'd like to talk with you about Alzheimer's disease treatments. For many years, we've had two types of medications that we can prescribe to slow or delay the progression of dementia symptoms due to Alzheimer's disease. Type 1 are medications that work on the brain chemical acetylcholine, and type 2 is a medication that works on the brain chemical glutamate. So how do these medications work? Well, they essentially work to restore or compensate for the chemical changes that occur in the brain when someone has symptoms of Alzheimer's disease dementia. In particular, there is a loss of the chemical acetylcholine in the brain when someone has Alzheimer's disease dementia. So the treatments geared at acetylcholine are designed to try to restore the brain levels of acetylcholine by preventing the breakdown of the acetylcholine that's still being made. So acetylcholine is normally broken down by a chemical called acetylcholinesterase. And so the Alzheimer's disease treatments inhibit that enzyme. They're called acetylcholinesterase inhibitors. The other type of medication treatment is designed to reduce excess levels of glutamate that can injure nerve cells in the brain. So the drug that helps to restore more normal levels of glutamate is called memantine, or its brand name is Namenda. And there are three drugs that work as acetylcholinesterase inhibitors, and those are known as donepezil, brand name Aricept, galantamine, brand name Razidine, and rivastigmine, brand name Exelon. These medications can have side effects. For example, the cholinesterase inhibitors, we want them to raise the brain levels of acetylcholine, but they can also increase acetylcholine in other parts of the body, which can lead to side effects. Most commonly, those side effects are with the intestinal system. So nausea or diarrhea can happen in around 10 to 20% of persons taking this type of medication. There's also acetylcholine in the junction between nerves and muscles. So sometimes people can experience muscle cramps or certain heart muscle effects, such as a slowing of the heart rate, although that's not very common. And we release acetylcholine when we dream. So one interesting side effect of the cholinesterase inhibitors can be more vivid or enhanced dreams, which can be good or bad depending on the content of those dreams. The other type of medication, memantine, that works on glutamate, has a different range of possible side effects that can include things like constipation, headaches, or sometimes just lightheadedness, although none of those are terribly common. So the side effects of these medications can differ, and these medicines differ in terms of who they are designed to treat. The cholinesterase inhibitors are typically used across the spectrum of dementia severity in Alzheimer's disease, so in individuals with both either mild, moderate, or severe dementia, whereas the glutamate medication, memantine, really only has shown a benefit when individuals have either moderate or severe Alzheimer's dementia, hasn't shown a clear benefit when individuals have milder symptoms. In June of 2021, the Food and Drug Administration approved a new treatment for Alzheimer's disease that I'll be talking about in a separate discussion. So stay tuned, and thank you for your attention and best wishes.